Hi, I'm Don Thompson, Director of Marketing, US&C for CARESTREAM Health. I'm here today with Lisa Hecht from Atlanta, Georgia, from Resurgens Orthopaedics, a very large orthopedic group. About 100 physicians, I believe, 35 PAs that are also ordering studies, 21 locations, I believe you have.
Correct.
Here to talk a little bit about our OnSight system, cone beam CT system. They are using it at one of their sites, so if you could maybe start by telling me a little bit about, let's talk about the image quality. I know Dr. Gleason and some of the other physicians there, some of the comments you've heard back as far as image quality.
So the feedback I've been receiving is that the image quality is of high quality. Our radiologists have even personally called me to let me know what a great system the CBCT is. And we, as technologists, love using it. We have, with our 100 physicians, we have been testing it now for about 4 weeks, and we have close to about 15 doctors that are now ordering exams for the CBCT.
Good. What about, we've got some software as far as metal correction and things like that to prevent scatter. If you could speak to me about that, being able to see metal.
So anybody that has any metal in their in the images, we do a metal suppression, and with the metal suppression, it is so clear and detailed that it actually shows the threads of the screw, and it really helps see the images and exactly where the screws are.
Great. And then as far as, site prep and things like that, with the OnSight system, there's really not much site prep necessary. If you could speak to that, I believe you guys actually took perhaps an old exam room actually that's got some cabinets and things in it. You kind of stuck this device, rolled it in, plugged it into the wall, and used it in there. It's a pretty small room, I believe.
Yes, I don't know, I don't remember the measurements of the room.
Mm-hmm.
I want to say it's almost as small as a 10 by 10, but it does have cabinets in it. It originally, many years ago, was our DEXA room. It became our DME room, and we turned it over to our CBCT room without having to worry about any lead shielding, because the CBCT is totally lead lined, and the entire casing is leaded. Therefore, you do not need the lead in the walls. So we did not have to do any cosmetics, any renovations to the room. We could just roll that right in, plug it in, and get it going. So it was really an easy way to start CBCT.
Great. And as far as billing and reimbursement, I did hear that you're getting certification relatively quickly, sometimes within even half an hour or so from some of the carriers. If you could speak to that.
So the pre-certs do take anywhere from maybe 15 minutes to 2 hours, but it all depends on the wording and the cases. I believe it's getting a lot easier, and most of them are only taking anywhere from 15 to 30 minutes to pre-cert now. It was mainly because insurance companies were unfamiliar with the CBCT. They thought we were calling about a whole body CT scan, and with the CBCT, the cost involvement is less, the radiation to the patient is less. Matter of fact, we looked up what we were doing for an ankle CBCT, and we found that it was the same dose as an AP diagnostic x-ray of a knee. So we were amazed by that, and it's just been great.
Great. The other thing I know we talked about was, you have a number of locations, as I said at the start, a number of physicians and so forth. You have this one unit there right now. It sounds like if you could speak to some of the physicians who are actually sending people your way to use the device, and maybe potential in the future for, at other locations to have similar devices, if you could speak to that.
Right, they know we're testing right now, and so they know we only have the one CBCT, and some of our patients are driving 30 miles to come have a CBCT because they understand that even their reimbursement or their copay is going to be less for this study, and we can get them right in. So they can leave the doctor's office, come right over to us, and take care of it. Our 21 sites are spread out throughout the metro Atlanta area, and so we're just not around the corner from a lot of the sites, but the patients are willing to come and see us to have their CBCT done.
And the other thing I was going to ask you is about, the same day you're trying to do some imaging during the same day instead of having to refer them out oftentimes maybe for a CT. Is that what's happening? Sometimes during the same visit you're actually able to do a CBCT scan?
Yes, and actually, if they're at our site that the CBCT is at, we'll do same day, and then they'll go back and follow up with the doctor before they actually leave. If we're doing same
Same
day
visit.
from another site, they will follow up on a different day. But we can, as long as they're willing to come over, we're scheduling them 30 minutes apart, but they don't take more than a total of 5-10 minutes at max to do, and the imaging only takes 25 seconds. It's the reconstruction just takes a little bit of time, and we just like to make sure that's completely done before we send the patient on their way.
Great. Well, thank you, Lisa, very much for stopping by today.
Oh, thank you.